Hello radiographers. So let's do a multiparametric MRI of prostate. So as I started recording a little late, so you will miss the T2 sagittal planning. So let's start from the next protocol, T2 coronal, and now I am planning T2 coronal over the T2 sagittal as I get it earlier the previous scan that I forgot to record the screen. So now I'm planning the T2 coronal over the T2 sagittal. You can see that I angle the slice parallel to the prostate, long axis of the prostate, just under the urinary bladder, and decrease the slice to 20, and the slice thickness is 3. And I select the distance factor 0 so that there is no gap between the slices. So as the T2 coronal planning is completed, I just copied the plan for the T2 team coronal, the next sequence, and the machine automatically wants to increase the distance factor to 10, and the field of view is 250, and click apply. And now T2 transverse sequence opened, and I'm planning over the T2 sagittal, and for this plan the slices are perpendicular to the long axis of the prostate, and then click apply after the planning, and copy the plan for rest of the transverse protocols from the T2 transverse. And now I copied for T2 fat set transverse. Remind one thing that if you copy a plan from another protocol, all the parameters will be copied except the field of view. So you have to change the field of view manually after the copy. And now I am copying for the T1 transverse and also decreasing the field of view to 250. So if you take T2 sagittal first, then it's easy to plan rest of the protocols, because in T2 sagittal the prostate is seen. And now I'm planning for the diffusion, and the diffusion plan is almost the same as the transverse planning, but the field of view of the diffusion will be large, and then click apply. So now only the contrast protocols are remaining and the MRS. So I am dragging the MRS protocol to up. So this is the T2 sagittal. You can see that the prostate is seen, and also the bladder is filled with the urine. And for filming, select the series and also find the reference image of the sagittal and send them to the filming. And now in the filming, change the layout to 5x5. That means the 25 image will be fit in this film. And adjust the zoom pan as required, and don't forget to keep the reference image in the last segment. So this is the first film that I am filming. It's a T2 sagittal and it's a 3mm sagittal cut and center over the prostate. So if you want, you can print it in 20 format, 5 into 4 format, or 4 into 5 format, so that you can enlarge a little bit the posted area. So I'm taking time adjusting the contrast and making sure that the contrast is fine. So here I change to layout 4 into 5 so that the are a little bit large and zoom in, and it looks better than 5 into 5 because our target is posted. So anything far from the posted is not required to be included in this film. So this is the T2 team coronal and this is the T2 coronal. So I am checking the protocols, it's fine. So now I will print the T2 coronal, that you can see that I am scrolling and you can see the posted and the bladder, and some part of the bladder is protruded, I think, into the posted, or the urine is stuck here, or there is maybe a urethral block. So for filming the T2 coronal, I choose 4 into 5 layout so that 19 coronal image and one reference image fit in the film, and adjust the zoom pen and contrast. So this is the second film that I am preparing for multiparametric posted. And this is the T2 team coronal. Select the series and send it to the filming and also the reference image, and the layout is 4 into 5, and for reference image delete last image and the reference image will fit into the film, and remove all the reference image from the segments, and then adjust the zoom and contrast of the images and check out the previous film. So this team coronal image is characterized by the fat suppression. You can see that the fats are suppressed and it gives no signal to the soft tissues. So the soft tissues or subcutaneous fats area are dark, and this is the T2 transverse. You can see that the urine or urinary bladder is white because of the urine fluid appears bright in the T2 protocol. So let's check the T2 transverse. Here is the T2 transverse and you can see that the posted is seen. Very good. And there's some lesions inside the prostate. So let's measure the prostate, and this is 3.23 centimeter in width. I'm using the measurement tools, and the length is 2.5 centimeter. So it's better to give a measurement of the prostate, and it will help radiologist a lot to find out any enlargement of the prostate. So for filming the T2 transverse, I have choose the layout 4:6. That means 24 axial images will fit in the film, and removing the reference image from the segments. And now the reference image, find the reference image and put it in the film. For this you have to delete some images. I will delete the last one and the first one, and the reference will come inside the film in the last segment. And adjust the reference image by zoom it out and changing the contrast. So this is the third film that I am preparing. The first one was T2 sagittal, and the second was T2 coronal. The third one was T2 coronal fat cell, and this is fourth one. Actually, the fourth film that I am preparing is T2 transverse, and it's 3 millimeter slices over the prostatic area, and the T2 transverse fat set is running. And this is the T2 transverse fat set. You can see that the fat is removed from the upper part of the pelvis, and I'm filming this transverse T2 fat set transverse like the previous one. The film layout is 4:6. So 23 axial images and one reference image, total 24 images fit in the film. And this is the fifth film that I am preparing for multiparametric prostate MRI. So in multiparametric prostate MRI, along the normal routine protocol, you have to take mostly the diffusion protocol and also the uh, dynamic contrast protocol. And the MRS is not compulsory, but in this particular procedure, in this case, I took the MRS sequence that I will show now. So I'm finding the proper axial slice to plan the MRS protocol. So you can see that the number 9 protocol is CSI 3D SE, and this is the MRS protocol that is opened. So planning MRS protocol is a little tricky and it's challenging. So I will check both on the sagittal and axial. That planning is on the right plan. So my target is to plan the MRS protocol over the axial slice, because the lesions are seen in the axial slices properly. And now open the MRS protocol and couple graphics on, and drag the MRS plans, the boxes, over the prostate, and change the field of view. I am decreasing the field of view to the right, left, and anterior, posterior, and also the foot head direction, and make sure that the VY box, that the field of view or the field of view is just at the middle of the post-it, that the whole post-it is covered by the MRS boxes. So inside the white square is the volume square, and the rest of the boxes are the field of view. So scroll and check the nearest, select scroll and check nearest and couple graphics on, and move the boxes to the middle of the saturation band, and then couple graphics on, and then again move the plan over the post-it. So it's a little tricky to plan the MRS boxes over the post-it. So I think that's okay. This is perfect. And again I am checking on the sagittal image. The sagittal image shows the boxes were in upper position, so I drag the field of view over the post-it, and again I am checking the axial one, that the box is removed from the post-it. So again I will find the perfect slice to be planted, and again drag the slice to the over the post-it. This is okay, and then click apply. So now the